Hello, I'm Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, Navi Peth, Pune. Today, let us talk about what is the ALICE and the EMMA testing in IVF. Now, these two are the newest forms of technology to detect the cause of endometritis, which is one of the important causes of recurrent implantation failures and recurrent pregnancy losses in IVF pregnancies. We know that around 10% of the Indian women suffer from inflammation of the endometrium, that is the inner lining of the uterus where the embryo actually gets attached to the mother's womb. This infection, the commonest being tuberculosis, but there are several other infections which have been noted in the women globally, of which around 10% of the Indian women do suffer from the inflammation of the endometrium called as endometritis. So ALICE and EMMA are the most advanced genetic tests that are available to detect even the slightest amount of inflammation or infection of the endometrium, which may result in IVF failures, or even if the patient conceives in presence of this kind of an infection, she does not carry the pregnancy beyond 6 to 8 weeks and is one of the major causes of recurrent pregnancy losses. So what is exactly done? In this, if the patient is having a very tight os, then anesthesia can be given, or in certain patients it can be done without anesthesia as well, in which we take biopsy or pieces are taken from the endometrium, all 4 walls of the uterus. They are kept in vacutainers which are specialized, and the processing is done in generally genetic labs which are outsourced. After this, an array of the infective bacteria is obtained, and after the genetic analysis, the exact specific dedicated treatment for that particular endometritis can be done. There have been reports of pregnancies after this detection of endometritis and solving this endometritis in patients who have failed multiple IVF cycles before but have conceived after ALICE-EMMA therapy in IVF. So if you are a patient who has recurrently miscarried or has not attached the embryo to the uterus at all, do talk to your doctor about the ALICE and EMMA testing in IVF. Thank you.